In the sixth lecture في المحاضرة السادسة we are going to talk about intestinal sporozoa البوغيات المعوية. Intestinal sporozoa, most of them intestinal parasites, they belong to subclass Coccidia. They are small protozoan animals no more than a few microns in diameter, lacking movement devices and depend on dissolved organic matter. تنتمي أغلب البوغيات المعوية الطفيلية لرتبة الأكريات أو الكوكسيديا، وهي حيوانات أولية صغيرة الحجم ما بتجاوز قطرها بضع ميكرونات، تفتقد أجهزة الحركة، تعتمد على تغذيتها على المواد العضوية الخلوية المنحلة. They have two types of reproduction: sexual reproduction and asexual reproduction. إلا نوعين من التكاثر، تكاثر جنسي وتكاثر لا جنسي. Sometimes both reproductions can occur in one host as in Toxoplasma gondii. ممكن يحدث التكاثرين هذولا في عائل واحد. First example of intestinal sporozoa, Toxoplasma gondii. It causes human toxoplasmosis. Cats are the definitive host or final host of the parasite where sexual reproduction occurs, and oocysts of the parasite are placed with infected cat's feces alone, but not in other vertebrates such as humans, farm animals, and rodents. بتسبب للإنسان مرض التوكسوبلازموزيس. تعتبر القطط هي العائل النهائي لهذا الطفيل، حيث يحدث التكاثر الجنسي في القطط فقط، وتطرح فقط أكياس البيض للمقوس القندية في براز أو مع براز القط المصاب فقط، دون غيرها من الفقاريات الأخرى مثل الإنسان والحيوانات المزرعة والقوارض اللي بتعمل as intermediate host. They act humans, farm animals, and rodents, they act as intermediate hosts. The cat is infected with infected rodent or eating cyst with its drink or food, while infected humans and other animals are infected when they eat infected raw meat, foods, or water contaminated with infected cat feces. The parasite is present in the intermediate host in the lymph nodes, cerebrospinal fluid, and skeletal muscles. طبعا بتتم عدوى القط بافتراس القوارض المصابة أو تناول أكياس مع شرابه أو طعامه، لكن بتتم عدوى الإنسان وسواء من حيوانات المزرعة، خاصة الإنسان خلينا نتكلم بتناول اللي هو رو ميت، لحوم نية مصابة، وأطعمة أو أشربة ملوثة ببراز القطط المصابة. بتواجد الطفيل في العالم المتوسط في العقد الليمفاوية والسائل الدماغ الشوكي والعضلات الهيكلية. بمعنى حيوانات المزرعة حين ما تتناول الأعشاب بكون ما بين الأعشاب اللي أكياس البيض اللي بتنزل مع براز القطط، لكن بالنسبة للإنسان أيضا ممكن يتناول طعام أو شراب ملوث بأكياس من قطط مع براز القطط، أو من خلال تناول لحوم نية فيها الطفيل. Morphology. The parasite has a pear-shaped figure 8 of 3 to 6 microns called tachozoid, which has a plasma membrane and a nucleus and contains a number of different organelles. It parasitizes in the host cells and detransforms into oocysts. The diameter of the oocyst can range from 10 to 100 microns. Cycle. When the cat catches the rodents, mice, rats, and others infected with the parasite cysts, the cysts' walls are dissolved by the effect of the digestive juices. Then the parasites release that penetrate the epithelial tissue of the intestine of the cat. Then they go asexual multiplication by direct division, even if the epithelial cell is filled with the parasite, and these invade other healthy and reproduce again, and so asexual reproduction continues. However, some of them which parasitize on the epithelial tissue of intestine of the cat take different forms. They form large female gametocytes, macrogametocytes, and small male gametocytes, microgametocytes, which form zygotes. Each zygote develops into an oocyst, then the oocysts are passed in the cat's feces. The diameter of this oocyst is 10 to 13 microns and its wall is characterized by two layers. The substance containing it's not distinguished at the face but develops within days into two sporocysts. Each sporocyst contains 4 sporozoids. Toxoplasma lives in mammals such as cattle, sheep, pigs, etc., or birds where they are found in the brain, eye, or skeletal muscles as tissue cysts which contain protozoates. A human can become infected by any of several routes. First, eating undercooked meat of animals harboring tissue cysts. Second, consuming food or water contaminated with cat feces, or by contaminated environmental samples, such as fecal contaminated soil, or changing the litter box of the pet cat. 3. Blood transfusion or organ transplantation. 4. Transplacentally from mother to fetus. بمعنى بتنتقل من الأم خلال البلاسنتا للجنين. This is the life cycle of Toxoplasma gondii. Oocysts are all reproduced in the definitive host, members of the family Felidae. بمعنى أكياس البيض الأوسيست بتنتج فقط من القطط وعائلة القطط. Sexual cycle produces the oocyst which is excreted in the feces. بمعنى إنه فقط التكاثر الجنسي بيحدث في القطط وبينتج عنه الأوسيست. Sporulation results in the formation of sporozoids. طبعا في الكيسة هذه بيتم تحوصلها إلى 2 sporocysts. Each one contains 4 sporozoids. Sporulated oocysts remain infected for months. طبعا لما يخرج الفيسز في هذا الأوسيست بتضل هذا الأوسيست معدية لعدة أشهر. As you see in the picture, birds, goats, pigs, they are and human are intermediate hosts. As you see in the life cycle in the figure, the man gets infected by eating meat of goats and farm animals infected with the cyst contains a protozoa, or taking food or water contaminated with oocyst, or by placenta from mother to the fetus. These are the intermediate hosts, and this cat is definitive hosts. Symptoms and diseases. Mother to child. Congenital. المقوسات الولادة. Generally, if a woman has been infected before becoming pregnant, the unborn child will be protected because the mother has developed immunity. If a woman is pregnant and becomes newly infected with Toxoplasma during or just before pregnancy, she can pass the infection to her unborn baby. Congenital transmission. Infants with severe congenital toxoplasmosis usually have symptoms at birth or develop symptoms within the first 6 months of life. Symptoms may include premature birth, اللي هي الولادة المبكرة. As many as half of infants with congenital toxoplasmosis are born prematurely، بمعنى أنه نصف عدد الأطفال اللي بيعانوا من داء المقوسات الخلقي بيولدوا قبل الأوان. abnormally low birth weight، بمعنى انخفاض في الوزن عند الولادة. eye damage، تلف العين. jaundice، yellowing of the skin and whites of the eyes، يرقان واصفرار الجلد وبياض العينين. diarrhea، vomiting، anemia، difficulty feeding، swollen lymph nodes, enlarged liver and spleen, macrocephaly and abnormally large head, macrocephaly and abnormally small head. These are symptoms of born child taking the toxoplasmosis from the infected mother. Also, skin rash، طبح جلدي، vision problems، مشاكل في الرؤية، hearing loss، hydrocephalus and build-up of fluid in the skull, intracranial classifications, evidence of areas of damage to the brain caused by the parasites, seizures, mild to severe mental retardation. The second is acquired toxoplasmosis، بمعنى داء المقوسات المكتسب. It appears in two forms, mild and severe. Mild form، الشكل المعتدل. It is characterized by spread of the parasite throughout the body and leads to symptoms that appear in the form of swelling of cervical lymph node and exhaustion and muscle pain, intermittent light fever, anemia and low blood pressure, and the proliferation of lymphocytes and liver function disorder. Liver function disorder. While the severe form، الشكل الشديد من المرض، it appears in the form of rapid attack characterized by rash، طبح جلدي، high fever, and the collapse of the body, mentally, inflammation of the brain, meningitis, hepatitis, and inflammation of the heart muscle leading to death. Also, eye infection can occur, causing blurry vision and eye pain. Diagnosis: by examining samples taken from the patient's cerebrospinal fluid after purification or from lymph nodes or bone marrow, and microscopic examination after staining with Giemsa stain. Second, by conducting a test to detect antibodies to Toxoplasma in the patient blood. Epidemiology and prevention. الوبائية والوقائية. Toxoplasmosis is a cosmopolitan disease and its prevalence in human is about 20 to 75%. If you have a cat, do not allow your cat to eat a mouse, bird, or raw or uncooked meat. The cat should be fed with commercial cat food and not allowed to leave the house. Daily clean the cat's feces with a special container and do not let the pregnant woman clean the waste can. Children's sandbox are also covered because the cats will always use sandbox. Even the feces are removed. They remain contaminated with the parasites. Avoid contact with cats outside the home. To protect your hand from contamination with cysts, wear a glove when working in the soil or garden or the rose beds that the cat may use to stand out. Avoid eating raw meat or incomplete cooking. Be careful of junk food such as hamburgers. Treatment by or through sulfadoxine.